Welcome to Business Notes. I'm your host, Diane Bogino. My guest today is Dr. Candace Holmes. Dr. Holmes is a natural brain focus and attention specialist. She is also a licensed chiropractor and she is a speaker. Dr. Holmes is proud to offer patients a drug-free approach to a wide variety of neurological disorders. On a personal note, she has lived in Michigan, Louisiana, Ohio, Kentucky, and now Georgia. She was the first person to attend chiropractic school from her college, and she is the next president of the American Businesswomen's Association's Empowered Ladies Express Network chapter of Alpharetta, Georgia. Now, get your favorite note-taking method at the ready because you'll want to make lots of notes as Dr. Holmes teaches us how to have a healthier life. Dr. Holmes, welcome to Business Notes, and thank you for being on the show today.
Thank you for having me.
So what is the most interesting thing about you?
Goodness, I guess most people won't know that I was a surrogate twice. Yes, I have had children for two single women, and I'm actually writing a book about it, about those experiences.
My goodness, what was that like?
Well, they were each totally different. The biggest thing for me was to make sure my children knew that once this child was born, that it was going home with its mother. It wasn't staying here with us. That was the biggest thing. They were 8 and 10 at the time. So that was like, oh, wait a minute. Okay. So it was interesting because one of my daughter's friends, after the child was born, was saying to someone else, one of the moms heard it, said, yes, Dr. Holmes had a baby, but she didn't keep it. And so
no.
I said, that's just true. I said, but it doesn't sound great coming out of her mouth, because it's a child, how a child perceives everything. So yes, it was really rewarding to see the mom's faces when the babies were born, because these women couldn't physically have children. So it's not like they didn't want to just make sure their bodies were kept nice and, and young. They physically couldn't have children. So I really didn't realize how hard it is for some women to get pregnant. When I was married, within 3 months, my husband and I had, we were pregnant. And so I thought that was a process for everyone. And little did I know. You're
a better woman than I am. My goodness. Well, let us know when your book comes out. Okay.
Okay. I will do that. Thank you.
And so what is your life like behind the scenes?
Behind the scenes. Ooh, there's a lot of softball, a lot of track, a lot of basketball. I have 2 daughters. They are 16 and 18. Just past weekend, there was a tournament. It was a showcase. And so that's when college coaches come out and see how your children are performing, how the players are performing, and they offer scholarships or they say they're interested. So that was that. Last weekend, we were in Denver for another showcase for the entire week. So it's a lot of travel. A lot of people ask me, why do you do that? All your weekends are tied up. I said, my daughters are only young once. I don't want to have any regrets. I want them to experience everything that they can experience before they get out there in the real world. So between that and managing my practices and I'm going to be, I actually am the next president of the American Businesswomen's Association, the ELN chapter, which stands for Empowered Ladies Express Network in Alpharetta, Georgia. So that starts next month. So getting all that together. So busy, good busy.
Yeah, that is a busy time to be president of an association. Huh? Been there, done that.
Yes.
Yeah. And speaking about your business and speaking of speaking, tell us about some of your speaking programs.
I focus on different conditions. My primary one is ADHD, attention deficit hyperactivity disorder. I talk about the warning signs to look for when your children are young, and then possible ways to help that condition. I also talk about anxiety and depression, addictions, PTSD, the list goes on. It's a very interesting time now, just because of what happened last year and what is still happening at this time. I don't even want to say the word. A lot of people either possess those conditions and they've gotten worse, or people started developing those conditions. So my whole goal is just to educate people as much as possible about possible options out there to help.
Right. Yeah, I would encourage organizations to bring you in as well, because there's so much stress in the workplace today.
Goodness. Oh my goodness. It's very disheartening. It's very disheartening.
Yeah.
compounded with all the deaths that people have experienced too. You know, my mom passed away this year in March. And then my ex-husband passed away last year and he was only 50. So it's a lot of people out there suffering. So my goal is to help as much as I can.
Yeah. Speaking of your goal, tell us, what is your mission?
My mission is to educate. My mom was a high school language arts administrator when she retired. I grew up with a mom who was a teacher. I remember my classmates would say, well, you have to do well. Your mom's a teacher. I said, no, not necessarily. I mean, it would help. I said, it's just that was instilled in us. You know, my parents met in college. And so it wasn't a question of whether or not I was going, it was where. So I was a substitute teacher for 4 years here in Gwinnett County. And that opened my eyes to a lot of the challenges that our young people are going through that I didn't even experience. Thank God, you know, it's so my whole goal again is to educate those. I think the American Medical Association has done a great job of making people believe that they have to take a pill for everything. And that's not true. There are other more natural ways to take care of conditions that we're suffering from. And so like my oldest daughter was diagnosed with ADHD. And my doctor's in chiropractic, and as chiropractors, we're taught chiropractic first, drug second, surgery last. You know, so that's the order. So I took her to a psychologist, and even after a few sessions, the psychologist said, "Are you sure you don't want to put her on medication?" I said, "Well, there's a reason why I chose a psychologist and not a psychiatrist." I said, "I know the difference." You know, no, my daughter is so vibrant. She is a ray of sunshine all the time. I mean, everyone comes to me and says, "Oh my gosh, she's always so happy." And I say, "Yeah, she's always so happy." Sometimes it can be annoying that she's so happy. I'm like, my gosh, just, you know, but at the same time, I didn't want that joy in her to be squashed at all, to be quelled, to make her into a zombie, into someone that she's not. And so that's how I found out about the therapy that I offer. And so I'm just thinking about all the people out there, the parents who have children who, you know, they don't want to put them on medication, the adults who either were undiagnosed or misdiagnosed and are suffering as adults in their adult life and not being able to perform because they can't focus well, and having to go to sometimes even recreational drugs to try to, you know, get a handle on that. When I was in chiropractic school, one of my colleagues, you know, was on marijuana. And I'm like, how are you going to do that? You're going to about to be a doctor. He said, well, look, this is the only thing that I could do to just keep myself calm. He said, when I was younger, my mom would chase me around the house with a syringe full of whatever. I don't know if it was Ritalin at that time. I'm not sure exactly. And so she would finally corner him and have to inject him. And he said he would just go. And so he didn't graduate. I just want you to know he didn't finish. But I never thought about that as a way, you know, that's not my background. I didn't think, but, you know, there are people suffering. So he found something that was as natural as he could, you know, get, I guess, to just calm himself down so he could function. I said, well, there's got to be a better way. And there is. So,
yeah. Yeah. And you've got that. And if someone is interested, what does it take to be successful in your field, Dr. Holmes?
Listening. You know, we were given 2 ears and 1 mouth for a reason. My best thing that I do is that I listen. A lot of people, I think, just they're waiting to answer, you know, or to fix whatever you're saying. They don't truly listen. So my goal is to get to the bottom of it, to see, you know, what happened. A lot of people have past childhood traumas that they've not healed from, that they don't have any therapy from. And so my goal is to listen and to see if I can help that person. And if I can't, then I want to try to get them to someone who can.
Good, good. So what is next for you?
So the book is major. I am looking into opening up another office. I am, again, the president of the American Businesswomen's Association. And I just I want to get out there and just speak to as many people as I can, just to, again, enlighten and give hope and encouragement. A lot of hope is what people are missing, I think, these days. And there's always hope. So I want to spread that message and just to give people that sense of security to know that, you know, there are other options out there besides taking medications, because typically you've taken a medication for 12 or 15 years. And the only thing that's changed is your age and possibly your hormones. Well, most likely your hormones too. So that's what's next.
Yeah, there's always another option. I understand kind of off the topic a little bit, but oftentimes people commit suicide because they feel like they have no other options, but that's just not the case, of
It's
course.
not the
And
case. It's not the case. And the warning signs are there too. However, sometimes parents are so busy working, they're disconnected from their children. So if their children have no one to talk to, a lot of times there's bullying going on in schools too. And unfortunately, more often than not, I hear that the administration does nothing about it. It's like, oh, it's a part of life. Well, these are our children. We are supposed to protect our children. That's our number one job, is to protect them. They should feel safe going to school. They should feel safe walking to wherever they're going to, just all the way around, just safe, and knowing that those adults are responsible enough and are in tune enough to see and notice those warning signs. But lots of times you just go, 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 go. Just not even, say, seeing the forest for the trees. So that's my concern, and that's my
right,
goal, is just to open eyes, the open eyes of the public.
right. And what's the best way for people to get in touch with you, Dr. Holmes?
Sure. They can go to, they can actually give me a text message. They can text the word focus to 21,000. That's focus to 21000. And that gives my digital business card. And you can click on whatever way you want to get in contact with me, be it email or telephone, website. So that's the best way. So it's focus to 21,000.
And where is your current office, and where are you going to open a new office?
My current office is in Duluth. I want to move that to Johns Creek. And then I'm looking more so into the Alpharetta, Roswell area. I have to do some more research on that. But those are the areas that I'm looking into.
Okay, great. Well, you brought some good information and good options for people to consider without going the drug route. And I think that's important. And I think that organizations certainly need to contact you as well as individual patients to get some relief for their issues. So thank you so much for being with us today. I appreciate you coming on the show.
Thank you for having me. Thank you so much.
Thank you for watching Business Notes. We've been speaking with Dr. Candace Holmes, Brain Force Attention Specialist, licensed chiropractor, and speaker. I'm your host, Diane Bogino, bringing you business ideas you can bank on.